Gastroesophageal reflux disease, GERD, is a chronic condition in which stomach acid or bile flows back, refluxes, into the esophagus, the tube connecting your mouth and stomach. This backflow irritates the lining of the esophagus and often causes uncomfortable symptoms. Causes of GERD. GERD occurs when the lower esophageal sphincter, LS, a ring of muscle that acts as a valve between the esophagus and stomach, becomes weak or relaxes inappropriately. This allows stomach contents to flow backward into the esophagus. Contributing factors include obesity, excess weight increases pressure on the abdomen, hiatal hernia, a condition where part of the stomach pushes through the diaphragm into the chest, dietary choices. Foods like chocolate, caffeine, spicy foods, citrus, and fatty foods can relax the LES. Smoking weakens the LES and reduces saliva production, which helps neutralize acid. Pregnancy, hormonal changes, and increased abdominal pressure. Medications. Certain drugs like NSAIDs, calcium channel blockers, and sedatives can relax the LES. Symptoms of GERD: heartburn, a burning sensation in the chest, often after eating, that may worsen when lying down. Regurgitation, sour tasting acid or food returning to the mouth. Chest pain can mimic the pain of a heart attack. Difficulty swallowing, dysphagia, caused by inflammation or narrowing of the esophagus. Chronic cough, often due to acid irritating the throat or lungs. Hoarseness or sore throat, irritation caused by acid reflux. Bad breath, resulting from regurgitated stomach contents. Diagnosis: GERD is typically diagnosed based on symptoms, but additional tests may include 1. Endoscopy to examine the esophagus for inflammation, ulcers, or other abnormalities. 2. Esophageal pH monitoring measures acid levels in the esophagus. 3. Barium swallow X-ray visualizes abnormalities in the upper digestive tract. 4. Esophageal manometry evaluates muscle function in the esophagus and LES. Complications of GERD. If left untreated, GERD can lead to esophagitis, inflammation of the esophagus; esophageal stricture, narrowing of the esophagus due to scarring; Barrett's esophagus, precancerous changes in the esophageal lining; esophageal cancer, increased risk, particularly adenocarcinoma; chronic respiratory problems such as asthma, bronchitis, or pneumonia. Treatment of GERD. 1. Lifestyle changes. Maintain a healthy weight. Avoid trigger foods and drinks. Eat smaller, more frequent meals. Avoid lying down immediately after eating. Wait 2 to 3 hours. Elevate the head of the bed during sleep. Quit smoking and limit alcohol. 2. Medications. Antacids neutralize stomach acid, e.g., Tums, Maalox. H2 blockers reduce acid production, e.g., ranitidine, famotidine. Proton pump inhibitors, PPIs, stronger acid suppression, egomeprazole, esomeprazole. Prokinetics help empty the stomach faster, e.g., metoclopramide. 3. Surgical treatments for severe or refractory GERD. Fundoplication, wrapping the top of the stomach around the LES to strengthen it. Lynx device, a ring of magnetic beads placed around the LES to prevent reflux. Prevention tips. Maintain a balanced diet and avoid overeating. Limit foods and behaviors that trigger reflux. Wear loose-fitting clothes to reduce abdominal pressure. Practice stress management techniques. If you experience frequent GERD symptoms, consult a healthcare provider for proper diagnosis and treatment to avoid complications.